A lot of parents right now are wondering, what do they do if one of their kids comes down with the coronavirus? One mother of a 7-month-old with coronavirus symptoms shared her experience in fighting for her baby's recovery. Take a listen.
Right. Yeah, it was very scary because there's no other, known cases of babies and small children. So it was very scary because you don't know, they haven't had tested children or, haven't done any studies in little small babies. So we're still very nervous because you still don't know if things can take a turn for the worse. So yeah, that's a very scary diagnosis. So they haven't given us a whole lot of information. He is doing well. We have noticed an increase in coughing, which, in the beginning, he just had a small dry cough. Now he's more congested with the congested cough, excuse me. And he is just being a little sick baby a little bit, just not feeling as well as normal, a little more clingy, but he is doing well. We're home, resting and taking it day by day. They didn't give us a whole lot of information on, what to expect in the coming days. I don't really know if there is a whole lot of information. He's not on any medications or anything like that. So that's a little unnerving too. I mean, he is doing well right now today, but we don't know if he's going to take a turn for the worse. And with us being on our legal contract to not leave our homes, we would have to call 911. So, I mean, it's scary not to be able just to drive to the hospital or to the doctor's office when, if you feel like he needs to be seen again. It was very emotional seeing him so sick because he was having to be poked so many times and he's so little. I get emotional thinking about it because, with your kids, you just don't know. You're so uncertain, and then they're so small, and they're just looking at you for help. And it was very sad to see him just so out of it with a high fever. He was very lethargic and he was responsive, but you could just tell he really just did not feel good at all. And it was very heartbreaking.
Heartbreaking indeed. We are hoping for that baby's recovery. Now, we're answering more of your questions about the coronavirus with our medical experts here. Back here to help me is Dr. James Wantuck. Doctor, I don't know if you were able to watch or listen to that story, but a baby, this is tough because, toddlers, babies, infants, they can't really tell you what their symptoms are. You've just got to see it for yourself, right?
This is scary, and certainly one of the bright spots so far in this pandemic has been that children have been relatively unaffected. They haven't had severe symptoms. They're still carriers for the illness, but it seems like they're not getting as severe disease. And certainly I'm hopeful that that's the case with the person you're just speaking with.
It's also tough because kids need their parents' affection, right? It's not like you're going to be able to say, no, I'm not going to hug you. You're going to stay in isolation. As a parent, is there any way to protect yourself from coronavirus if your little one has it, or is it a case where you're probably looking at the likelihood that you're going to catch it yourself?
I think that's right. Kids, they don't listen to the public health experts, and they're not germaphobes like maybe some of us are as adults. And so they are probably going to touch you. They're probably going to sneeze and cough around you. And so that might be a risk you have to take as a parent.
Is there any way to talk to kids to make them germaphobes? I mean, you're, as a doctor, I'm sure you see this a lot, a way to impress upon kids that they should wash their hands?
Yeah, I mean, I think this is something that every parent struggles with, is trying to teach their kid about germs and hygiene and wash your hands and be safe and all kinds of things like that. And it's just going to take time. I think kids will pick up on cues from adults, and they sort of monkey see, monkey do, right? They learn from us. And so if we're showing good behavior, they will too. And I think the other thing I would say is it's important to keep those kids maybe away from their grandparents and away from other family members, even if you as a parent have to, have close contact with them.
Yeah, really important to remember. Now, we're going to turn to some questions from some of our viewers. If you have a cut on your hand, can you get the coronavirus through the cut?
Probably not, or almost certainly not. The virus likes to bind to the receptors in our lungs. And so that's why it's a virus that transmits through the air and through respiratory droplets. And so it's not a bloodborne disease.
And doctor, we're hearing in places like New York where it's very difficult to get tests, that there's the likelihood that you may have symptoms, you may have coronavirus, but you might never get tested. So if you have the symptoms and then your symptoms go away, when are you in the clear? When does that 14 days actually start and end?
Yeah, so after your symptoms start, it seems to be about 14 days where you're still infectious. And that's maybe a little longer in people who are sicker, and it could be a little shorter in people who are less sick. So that's the best evidence we have right now.
And what about people that might be pregnant and might be very close to their delivery date? Is the hospital safe right now? Should you or your spouse or your partner be in the delivery room or going to the hospital if it's not COVID related?
Yeah, so this is a real struggle. My wife, who's also a doctor, is a pediatrician, is 7 months pregnant right now, and we're trying to get those questions answered for ourselves. We're not sure if I'm going to be able to be there. It depends on the hospital policy at the time and the place in the country where you're located. I think we have to maybe come to a realization that this is severe enough that it might not make sense for the husband to be there or the partner or spouse to be there at every delivery. We're hopeful that that's not the case. Obviously, I'd love to be there, but it might not be possible. We'll have to see.
Wow, fingers crossed. So basically you're saying that because you don't want to expose both parents, there's the possibility that your wife might have to deliver alone, so you're not exposed.
Well, because I'm not exposed, or I don't expose other people in the hospital. If by chance I'm asymptomatic but still infectious.
Right.
This is the whole point of social distancing. The less people in the hospital, the better off all the patients are, and so that's what we're trying to accomplish.
Well, I want to take this moment to thank you and your wife for everything that you guys are doing. You guys are on the front lines, and we can't tell you how much we appreciate it. Now, it's allergy season. Sore throats and stuffy noses are kind of the norm right now. How can you tell whether something is allergies or the coronavirus?
Yeah. The coronavirus has symptoms that are really variable, and so it's not the same symptoms every time. And so, while itchy eyes, watery eyes, stuffy nose is probably not coronavirus at this point. If you have any symptoms at all, you should probably be separating yourself from other people. And so, I'll say, allergies, try a Zyrtec, try a Claritin, see if it works. If it does, great, but still keep your distance, be washing your hands.
Well, doctor, again, we want to thank you from the bottom of our heart, and thank you again to your wife as well. We're hoping that you have a beautiful baby very, very soon. Congratulations on that. And thanks again for your time.
Thank you very much.